Hi everyone, my name is Jessica. Thank you for taking the time to tune into my brand spanking new channel. Sorry in advance because I'm not good at making eye contact, even with a camera, maybe especially with a camera. So, like I said, my name is Jessica. My husband's name is Stefan, and we have a son named Wynn who is actually just turned 18 months. Wynn has congenital heart disease. He was born with critical aortic stenosis. My husband and I met at work. After dating for 5 years, we got married. And about 2 months after we got married, we found out that we were expecting. It was really exciting and terrifying all at the same time. So as far as Wynn's diagnosis, so we had our 20-week scan, which is 20 weeks is sort of the baseline. That's the time that just about every pregnant woman will have a scan or an ultrasound done, just to see how the baby is growing and make sure that they're on track and healthy, and look out for any signs of any health concerns for the baby. Everything was normal. He looked healthy. He was growing. He was doing great. He was thriving. But maternal fetal medicine wanted us to do an additional scan because we had traveled. So we got married, like I said, and then 2 months later we found out we were expecting. Well, in between there, we traveled to Mexico for our honeymoon. And so maternal fetal medicine wanted to do an additional scan just in case, just to watch out for any signs of Zika. So they did that additional scan at 28 weeks. The scan happened. The ultrasound tech said, okay, we just finished with all the images. I will go and pass this off to the one of the OBs, and they'll be back to talk with you shortly. Shortly definitely wasn't the case. At the time, I think I was under this like blind impression that, oh, it's fine that it's taking a long time because, you know, it's just a really busy unit, busy doctors, you know, maybe they're just tied up with other patients or they're behind schedule for the day, so they're just trying to like finish things up. We ended up waiting, I want to say close to like 45 minutes for the doctor to come. So he came in and he was like, so the scan's looking pretty good. There are no signs of Zika. And we were like, sounds like there's a but in there. So yeah, he said, you know, there's no signs of Zika. His growth is amazing. He's moving. He's doing practice breathing, which is a really good sign. And then he said, but we're a little concerned about his heart. And like kind of at that instant, for me, I can't speak for my husband, but for me, it was like, just like my heart kind of sank at that moment, because I'm like, ooh, his heart, like of all the things, you know, they could have said like, oh, his arms are short, that's kind of weird, or, you know, I don't know, that's stupid. But yeah, I think I was kind of floored just by hearing but his heart, and you know, that kind of spooked me. He basically explained to us that the left side of his heart was like it was oversized and it wasn't squeezing, and that his heart as a whole, like his entire heart, was taking up about 1/2 of his chest cavity, and that a healthy heart at this stage should be taking up about 1/3 of the chest cavity. So, you know, both just kind of, we got in the car and we just kind of like we took a big sigh and we just kind of looked at each other and we were like, what does this mean? Like, what do we do? You know? So yeah, they gave us that information, and he said, you know, I'm not a cardiologist. I can't diagnose what is causing this for your child, but we were concerned because he had already, like, he came in with a piece of paper and he's like, we've made this appointment for you to meet our pediatric cardiologist, and she'll be able to diagnose, you know, what his condition is and what the cause of it is. And then we've also scheduled a time for you to meet with a genetics counselor, who can maybe try to offer you more information, and she's going to ask you questions about like your family history and see if maybe that is a reasoning for his heart condition. So that all happened, I think, on a Thursday or a Friday. The soonest that the cardiologist could see us was the following Wednesday. So we go to that appointment on the following Wednesday, and they are doing, they're doing a fetal echo, which when you're pregnant, it's pretty much the same as an ultrasound scan. All they're doing, it's really the same as an ultrasound scan on the outside, but like the images that they're getting are different, of course, because they're detailed and focused in on the infant's heart. So they do the fetal echo, which took probably like 45 minutes or so. They brought us into a separate clinic room, and we waited for the cardiologist in there. Her name was Dr. Rock, and she's amazing. I think she came in, and to be honest, I think really I blocked most of what she was saying to us out, because I was so scared, and like my brain was just in sort of this panic mode. And honestly, to this day, whenever people ask for like details about our son's condition or his diagnosis, or like what the outlook is for him, honestly, if you come to me and say, oh, how's Wynn doing? What's the next surgery that he needs? I literally, it's like my brain just kind of goes like, because I just get freaked out. And it's not really that my brain shuts down. It's like it goes into this panicked like overdrive, and I just hear all these voices in my head that are like, he's sick, he's not okay, something's wrong, like something's gonna go terrible, and something awful's gonna happen, and there's nothing you can do about it. And it's just like, it's just really overwhelming. So to anyone who I know personally who's asked me for like an update on my child, I'm really sorry if I can't give it to you, and I hope, I mean, I'm sure I speak on behalf of other parents of kids that are like medically complex. It's just a hard topic. It's hard to think about, you know. It's something that I wish you could just come up to me and say, how are you guys doing? And when I say, oh, we're good, you just say, oh, that's good, and like leave it. I don't know. I get the concern though, and I appreciate the concern. It's not that I don't appreciate it, it's just that I don't like to talk about it. I have a hard time with it. So I'm trying to like do better and be stronger, I guess. I'm more like confident and kind of overcome this like panic and fear that I always have in the back of my mind. It's just a work in progress, and I don't think it'll ever be easy, but we'll get there. I mean, we'll get through it, I guess. We won't get really anywhere. It's always going to be overwhelming for me, I think, but at some point, I think I'll learn to like think over those voices in my head. That's my goal. So anyways, as Dr. Rock was explaining Wynn's diagnosis and like the physiology of his heart to us, I was just waiting for her to get to the part where she would tell us like what his odds of survival are. Because the one thing from maternal fetal medicine before we met with the cardiologist, the one thing they told us was like, please don't Google. Please don't Google, like you'll make yourself sick, just please don't. But I did, you know, like I'm gonna not, right? So of course I Googled things, and I was curious, and I wanted to know more, and I was so scared, and like, I mean, to like, can you imagine? I can you imagine being told that there's something wrong with your child's heart and then having to wait like almost like 5 full days to wait to figure out what that might be, or like if he's even gonna make it 5 more days? Like you don't know, like you don't have enough information. And that, I think that was a hard thing for me, especially as a pregnant woman, because like, you know, you're kind of sitting there and you're like constantly like, even if he wasn't kicking at that time, it's like I'd constantly be like rubbing my abdomen like is that a kick? Oh, I think we're good, I think we're okay. So it was just kind of freaky. So yeah, as Dr. Eck was explaining Wynn's diagnosis to us, I'm just like waiting for her to get to that part where she tells us what his odds are of surviving. I learned enough from the Googling to know that, you know, some kids, some of these heart conditions, kids they don't need medicine, they don't need intervention of any kind, they don't need therapy, they don't need surgery, they're just good. I mean, it's just like a condition, but they can live through it and live with it and be fine. She was like explaining that typically patients with Wynn's condition or Wynn's physiology or his plumbing, you typically need a series of 3 surgeries before age 3. And that was a lot of information for one very nervous pregnant woman to take. After she explained his condition and the treatment options, or like the typical treatment options, she said to us, I want to ask you guys a question, and I want you to answer without thinking about money or logistics. Just say yes or no. And then she said, there is an interventional procedure that can be done before the baby's born. If you were to go anywhere to do it, I would only recommend that you go to Boston Children's Hospital and meet with Dr. Turetsky, excuse me. And there's a good chance that they'll be able to repair his heart, or at least prevent it from progressing into a different condition called hypoplastic left heart syndrome, which is basically where it's basically like he would have been born with like half of a heart technically, because the left side wouldn't function. So yeah, that was a lot. Yeah, she's basically asking us if we want to pick up and fly to Boston and have some like, it almost sounded like experimental. And I think Stefan and I just kind of looked at each other at that moment. And like, I didn't want to pressure, in that moment, I felt like I didn't want to pressure Stefan into saying yes to that, but I knew in my gut that I wanted to say yes to it. But we had so many questions, you know, and like the darkest and first question I think that Stefan had the balls to ask and I didn't. Could you tell us, like, if we were to do nothing, what would his lifespan be? And that was like the hardest question I think we've ever asked. And she basically told us, like, typically from what she's seen, I think she said like it could be as little as like a few hours, could be as long as like a few days, maybe a few weeks, and that was it. And I was just like, so obviously we're going to Boston, like, you know, we're gonna do everything we can, and like if we can do something that might even protect him from having to have surgeries as a child, like, hell, we'll do it, you know. We want to help, we want to do the right thing, we want to make his life easier, we want to give him as close to a healthy life as we can. So of course that's what we did.